Adams.
Thank
Delegate
you, Madam.
Adams, no, please don't leave us yet. You have another bill. I want to go on and hear that while you're here, and that's
Yes,
House
ma'am.
Bill 1817, and that's the practice of certified nurse midwives.
Yes, ma'am. Thank you so much. And members of the committee, HB 1817 will allow certified nurse midwives to practice in their communities without the exorbitantly expensive and hard to find consultation agreement. As we face mounting healthcare workforce shortages, it is irresponsible to maintain unnecessary barriers to practice. Accessing maternal health care providers is already difficult for many pregnant women, especially in areas that already lack access to care. Across the country, that areas that removed these unnecessary agreements saw increase in the number of maternal health care providers and significant improvements in outcomes, including 13% lower odds of cesarean births, 13% lower odds of preterm births, 11% lower odds of delivering a low birth weight baby. This is of special concern during a time when we have large disparities in birthing outcomes, especially for Black women in Virginia, who are 2 to 3 times more likely to die of pregnancy-related causes. Over the last year, certified nurse midwives have stepped up to provide care in their communities, and we must allow them to continue serving. The research is unequivocal. Certified nurse midwives provide evidence-based, advanced midwifery care that is safe and effective. Since the beginning of the pandemic, Executive Order 57 removed these non-safety related regulations, including consultation agreements, so that CNMs could practice despite physician furloughs and clinic closures. During this time, the midwives have had no disciplinary actions taken against them. The national OBGYN groups wholeheartedly support this measure. And we've heard directly from practicing OBGYNs across Virginia about how these measures, such as expanding access to care, address the disparities in the outcomes. To be clear, consultation and collaboration is an expected and necessary part of the practice of clinical nurse midwives. Furthermore, they are subject to rigorous education requirements, which includes being the lead midwife on 35 births and participating in 60, which is a total of 95. They must be deemed qualified and certified to attend births upon graduation. Professional expectations regarding consultation and other healthcare providers is made abundantly clear through their training, certification, and standard of practice in accordance with our conversations with stakeholders and out of abundance of cautious. This bill also restates that expectation. We're living through the consequences of needlessly restricting the scope of practice of trained and educated health professionals. Our current policy is unproductive, wasteful, and costly. It's time for Virginia to join 28 other states in this country and modernize how we treat our maternal healthcare workforce. Thank you, Madam Chair.
Thank you, Delegate Adams. And I see that there is quite a long line of individuals in queue, and I'd like to move them into the waiting room. And my goodness, the line is growing. But I want you to be mindful of the fact that each side has 3 minutes. I want you to be mindful of the fact that there are others behind you who would like to speak. And when the time has gotten down to 30 seconds, I want those persons remaining in queue on either side just to state your name and say you are in support, or you're in opposition, and no further comment. And if we go over time, you will be silenced. And so we're going to start with those who are in support of the bill first. IT, if you can move them into the chat room, I'd like to begin with the first speaker. And it appears to be Natalie Snyder, is that correct?
Madam Chair, Natalie Snyder is being moved into the room, but if first Katie Page is already in the room, if she would like to start.
Katie Page, if you could go on and start. Be mindful of the fact that you're limited in the amount of time, and at the end of the time, we will cut off all other speakers. So please allow others the opportunity to speak as well.
Of course. Thank you so much. Can you hear me okay?
Yes, we can hear you fine. Thank you. Go right ahead.
Thank you. Good morning, Madam Chair, members of the committee. As Delegate Adams already mentioned, our competencies, standards, philosophy, and code of ethics are internationally supported, and midwives are deemed competent prior to certification, which is slightly different than other clinicians, including physicians in the state of Virginia, who are given unrestricted license to practice prior to board certification. There's been concerns shared that related to experience. Experience is most definitely important for practice. However, it does not establish competency or ability to practice for any professional, least of all certified nurse midwives. Midwives who currently have consultation agreements with physicians face the reality that if the physician retires, injures, or moves to another state, or simply decides they're no longer interested in collaborating, those practices must close. ACOG and the American Academy of Physicians and the American Academy of Pediatricians affirm in their statement on collaboration with CNMs and in their jointly developed toolkit on collaboration and team-based care, which is a national guiding document, explicitly state and support that full practice authority framework or independent practice, healthcare providers still collaborate with members of the healthcare team.
Half the time has been expired.
Natalie Snyder, followed by Arshia Kadir.
Good morning. This is Natalie Snyder, State Advocacy Director with AARP Virginia. We did send a letter of support earlier this week to full committee, so I'll keep it brief and just say that we do support the bill and we urge you to vote it forward. Thank you.
Thank you very much. Next speaker.
Arshia, please unmute and go ahead.
I'm in opposition.
Okay, next we have Julianne Condry. Please go ahead.
Madam Chair, members of the committee, on behalf of the Virginia affiliate of American College of Nurse Midwives, we support this bill, which is also supported by the National Black Midwives Alliance, the National Association to Advance Black Birth, Yale University School of Nursing, Shenandoah University Midwifery Program, AARP, and the Association of Women's Health, Obstetric and Neonatal Nurses, and the Virginia Nurses Association, among others. And I cede the rest of my time. Thank you.
Thank you.
Gabrielle Amanuta.
Gabrielle, if you could just give us your name and the organization that you represent. We need to get as many speakers as we can who are in support. We'd like to hear their names. Please go ahead.
Gabriela Matuna, representing Mystic Flow Wellness Center.
Thank you.
Okay, I'm here to highly support this bill because as a community health worker and health educator, I'm seeing the impact that these certified nurse midwives are doing in the community and how the health outcomes are being improved.
Thank you. I'd like for everybody else just to give me your name and say support, please.
Clarice Wardlaw.
Yes, I'm here as a CNO serving in the Black community. I give my full support to this.
Thank you. I'm sorry, the time has expired for the side for those in favor. Now I'd like to hear those in opposition. We've got to move the calendar. So those in opposition, please step forward.
If those in opposition could please digitally raise their hands. First, we have Dr. Aaron Goldberg being moved into the room. Aaron, please go ahead. Aaron Goldberg, please unmute.
Hello, I'm Aaron Goldberg. I'm an OBGYN speaking in part on behalf of the American College of OBGYN Virginia section. Thank you, Madam Chairman and members of the committee. I just want to clarify, we don't necessarily oppose the bill. We just want to speak out and clarify that we do very much support the practice of midwifery and think it's a great model of care for many women, both in the nation and the Commonwealth. We just support a transition to independent practice that would allow some level of collaborative practice at the outset of graduation from a program and set a minimum standard of births that would be collaboratively supervised by either a doctor or a trained midwife. So it's not that we think doctors should be the ones supervising, just a trained practitioner, so that eventually the transition to independence would be assured by a period of time where a certain number of births could be assured in practice. Similar, you might say, to residency for physicians, although I don't think it's fair to compare the training for midwives to physicians, given the different patients that we do care for. I will cede the rest of my time, given the short number of comments, but just to clarify, we support an amendment, we are not in opposition necessarily.
Thank you very much. And I do appreciate the speaker's understanding that we do have a lot of other work that we have to get done, and I'm sorry that we can't entertain the comments of all of those individuals who come forward each morning. With such a long line, if we did that, we'd be here for the rest of the day. Next speaker, please.
Next, we have Arshia, followed by Nicole Lauder.
Good morning, Madam Chair and members of the committee. I'm Dr. Arshia Kadir. I'm speaking on behalf of the Virginia chapter of the American Academy of Pediatrics in opposition. It's very important to remember that at every delivery, there are two patients, the mother and the baby. We are very concerned about the potential ramifications of this bill, specifically in regards to home births. Infants are twice as likely to die and 3 times more likely to have seizures and serious neurologic complications during a home birth as compared to deliveries in a controlled setting. Expanding the scope of practice for any practitioner must always be met with an awareness of the safety of the patient first. Our Hippocratic oath is to first do no harm. It's important to recognize that states that have permitted autonomous practice for CNMs have done so with rigorous transition to practice requirements and regulations in place. There's too much at stake to move quickly on this. We would prefer that the committee have the Department of Health Professions study this, as they have with other scope of practice issues, before moving forward. For that reason, we ask that you say vote no on this legislation. Thank you.
Thank you for your comments, and the time has expired. I'm sorry, if there are other members in the queue who have not had a chance to speak, if you would forward your comments, we will have those documented. Now turn to the committee for any comments and responses that you may have.
Madam Chair,
Delegate Adams.
may I just speak to the comments made?
I think we probably need to move on to the Senate at this point, and then and get their questions and then come back to you if that's necessary.
Thank you.
Madam Chairman,
Senator Donovan.
I just want to note, somebody that did not get to speak wanted to point out that the Professional Association, I guess, of Midwives recommends 90 births, whereas school accreditation only really covers 20 births. And I think I have to resonate the concern about independent practice from a 2-year training program and 20 births to no collaborative relationship, because I think that speaking from experience, 20 births isn't that many. And so, I think that there's some suggestions that we're going to hear about this bill, but I just wanted to make that comment because Nicole didn't get to speak.
Thank you, and I can appreciate you making that comment, Senator Donovan, but again, I want to reiterate the fact that what we have is when we have 20 speakers in queue, there's no way we can entertain all those speakers and get through our work. And so at some point, we do have to cut off the comment. So with that, I'm going to turn to Senator Newman.
Madam Chairman, I think that we've heard a number of reasons why someone would want to vote for this, and a lot of reasons why we may not. I think in the Senate budget this year, the chairman has in there a number of study points on broad issues related to scope of care and that type of thing, and there's information in there to take a look. And I think in the past, a lot of times on these type items, we've asked the department to actually provide to us the information related to the positive, negatives, and potential other impacts. Oftentimes in these bills, we'll hear that 28 other states are doing it, but we don't know exactly what 28 other states are doing. So, Madam Chair, I would feel much more comfortable about this as at some point we got information back related to what the scope of practice in other states are, and also the potential healthcare impacts, but also how we make sure that this type of product is available more broadly, especially to some of the more rural areas. So I believe it's an item that we very much may want to take a look at, but I would love to take a look at it with more information, Madam Chair.
Comments by any other members of the committee? Delegate Adams, I'd like to have you wrap it up before we make a motion.
Ma'am. Thank you so much. I do want to make a couple things clear. First of all, there is zero expansion of practice in this bill. Secondly, the statistics quoted by Senator Donovan are just plainly incorrect. In order to graduate, there are already 95 births, 35 of which are lead births. So I do want to make that clear that those statistics are incorrect. And then as a request that I heard secondarily from Senator Newman about practice standards, I did send each of you all some charts that show that the malpractice is basically negligible amongst advanced practice nurses, which include midwives. And so this practice has been going on safely. What we're talking about is eliminating a piece of paper that often costs the nurse midwife a fair amount of money. And again, the national ACOG supports this, and our state ACOG does not support it. So I want to just make those points clear. Thank you, Madam Chair.
Thank you very much. I'd like to entertain a motion from the committee. Senator Newman.
Madam Chair, here again, I think that the best way to do it, from my perspective, is to get more information from the Department of Health and health professions and then report back to us and get more information. And Madam Chair, it may not be the will of the committee, but I would move that we plan to send the content of the bill to the department, have them report back to us next year. That would be my motion, Madam Chair.
Madam Chair, I'd second that as well.
Senator Newman, well, there's a motion on the floor now, but I did have a question about whether or not the administration or the Department of Health had an opportunity to weigh in on this bill before now. I mean, why are we sending it to them now when they've had all session to weigh in?
Madam Chair.
Madam Chair.
I think I heard legal first, and now I'm hearing Senator Barker. I want to go on with you, Julia.
We can check if he's still in the room, but Jay Douglas, who's the executive director of the Board of Nursing, was planning to be on the call, and he may be able to answer questions.
Yes, I'd like to hear from him, please, because I'd like to know what the administration's position is, because I don't want to just send the bill back. If administration had an opportunity to weigh in on this bill all session and we've not heard anything, I think it's a bit late now for us to talk about referring it back to get more comments from them. They've had the entire session to do that, Senator Newman.
Madam Chair.
Madam Chair.
Senator Barker.
Yes, the standard practice in a lot of these situations where we're looking at expansions or changes in terms of what the regulations are for various health professionals is to refer the issue to the Department of Health Professions, which then during the year does a study of it, involves stakeholders in the process, has their various boards that review these types of things, and they issue a report, and then it comes back the next regular session of the General Assembly with that report and can address it at that time. I think that the current regulations have been around for a good while, and do allow a fair amount of latitude in terms of how how the situation can evolve over time. But I think it would be worthwhile following the recommendation and the amendment offered by Senator Newman and the administration. I'm chair of the Health Professions Subcommittee, which this did not go to, but I've not received any indication from the administration that they have taken a position on this bill.
Madam Chair.
Senator Donovan.
I just want to say, I in those earlier statistics, I was literally reading from something that had been texted to me, so I don't have any firsthand experience in that. I am very supportive of midwifery and introduced a midwifery program to the hospital where I work, and I think the concern I have is there is not, kind of a consensus on this, which is what I think Senator Barker is attempting to achieve. And the concern that's been expressed to me by pediatricians particularly is the not having a bridge between a 2-year training program and independent practice. And the bridge is not in any way designed to demean anybody, but just really to make sure we've covered all the issues. And so I think that I can't answer the question, about whether or not it's okay to make this decision, but I think the Department of Health Professions can, and they are our subject matter experts that usually come back with a well-informed opinion of how to move forward safely, and I would support the decision to have this looked at by the Department of Health Professions.
Well, I'm going to take the prerogative of the chair to say that this would not be the direction that I'd like to take. I was delivered by a midwife, and so were all my sisters and brothers. And I know that this is something that's very important to a community like mine.
Madam Chair.
And so I don't especially support the motion, but the majority rules.
Madam Chair.
I don't know who's speaking.
It's Peterson.
Peterson.
Yes,
Senator
ma'am.
Peterson.
Yes, ma'am. I just want to say, and I realize I'm cautious about speaking on health professions because I'm way outside of my lane. I defer to Senator Donovan and Senator Barker, but it is frustrating whenever we get these scope of practice bills. There's always pushback.
Yes,
always pushback. And this delegate has done an extraordinary job of marshaling statistics and graphs, and I've actually been going through it while we've had this hearing. And, it seems to me this is a reasonable step. We're always told to defer it to this committee, to that committee, this commission, that commission, this administration, that administration, the International Tribunal on Doctors, I don't know. But I think this is a reasonable step. But again, I'm an amateur here, so I support you, Madam Chair.
Wait a minute, I got to exhale for a minute.
Madam Chair, I'm exhaling with you. I was also delivered by a midwife.
And the motion was?
Senator Newman had made a motion, which I seconded.
Okay, then we'll take that motion up first. The motion is to refer to the health professions.
Right.
And so let's do electronic vote, please. The motion on the table is to refer it to the... That was not what I heard. Steve, what was your motion? Senator Newman?
Madam Chair, it was to report the content to the committee, and the bill will probably stay in the belly of the committee, but it will send the content to the health profession so we can get more information. Madam
Okay,
Chair.
I want to just get a clarification from the clerk. Okay, if this motion fails, then we can go to the motion to approve the bill, right? To report the bill. All right, well then we will vote on that motion first. All in favor of the motion by Senator Newman and second by Senator, I think it was Suderline?
Madam Chair. Madam, was it?
Okay.
Madam Chair.
All right, I hear that. So I'll hear from the clerk.
Yes, ma'am. So the motion is being made to refer it to a subcommittee?
Is the PBI with a letter which, yes, that was his motion. Am I correct?
Madam Chair, that really is technically the only way to do it. So the clerk is correct, but it would get the content to the department. Yes, ma'am.
All in favor of that motion, please vote electronically. No.
Ayes 5, noes 10.
Ayes 5, no 10. That motion is defeated. Can I entertain a second motion, please?
Move to report.
It has been moved and probably second that the bill be reported. All in favor of that motion, please designate electronically. Those opposed have the same right.
Ayes 12, noes 3.
Ayes 12, noes 3. The bill is reported.
Terrific, Madam Speaker. Thank you, members, so much.
Thank you. Have a blessed day. House Bill 1953, Patriot Goditis.